As a functional and naturopathic doctor, I see a lot of patients with high cholesterol, high levels of insulin, resistant weight loss, and collectively these symptoms are all falling into a category or a condition called metabolic syndrome. Now, in one of my previous videos, I talked about how cholesterol is not really the right problem to be treating. What we actually need to consider is levels of inflammation. And in this video, we're going to talk about how we can address levels of inflammation, where could this level of inflammation be coming from, and some treatment options. First off, how do we test for levels of inflammation? It's a simple blood test. HSCRP or ESR can give you some good insights. Secondly, where does inflammation come from? Well, inflammation can come from an injury, chronic infection, even a low-grade chronic infection. You want to consider if that's a possibility for you. Nutrient deficiencies like vitamin D deficiency, being dehydrated, being sleep deprived, having a poor diet or a standard North American diet with lots of processed foods, sugars, alcohol, all of that can create more levels of inflammation. In addition, autoimmune conditions can cause inflammation as well. So you really want to figure out why or what is contributing to your specific levels of inflammation, then treat that issue. Now, how do you treat levels of inflammation? It's really important to look at what is causing the inflammation for you and treat that. Now, you always want to figure that out before adding on even natural anti-inflammatories like curcumin, fish oil, annatto E, berberine, NAC. All of these things can be helpful, but the goal is to try to figure out where it's coming from for you, the specific individual. You can use these supplements in combination, but always try to look for what your cause is.